Hello, my name is Sarah, and this is my health story. I have been working in integrated care for probably about 6-7 years. One specific provider and I have been working to tweak the co-visits. You know, one patient that I've really seen this work with, she came in just a couple days ago actually, and the patient is in cognitive decline. That is clear. We've had challenges with her medical power of attorney, which is her daughter, because her daughter doesn't understand. She keeps wanting the provider to give her mother anxiety medication because she is telling us that her mother's experiencing anxiety. So the provider and I finally decided this is necessary. We need to have a co-visit. We thought that they were a great candidate. So we brought the family in and we discussed with them what anxiety medicines do, how her mother's experiencing anxiety, because now her mother's in cognitive decline. She does not experience anxiety the same way that you or I do. Really what her daughter is associating with anxiety is her mother's confusion of trying to put together bits and pieces of a world that makes sense. At that point, it was overwhelming for her daughter, right? Because this has been a challenging experience, and we were able to lay out for her daughter, what caregiving is going to look like, and that she needs to make these decisions now rather than 6 months from now or a year from now, because the patient has been shuffled back and forth between daughter and son, so she's getting even more confused, more disoriented, because nothing is becoming procedural, nothing is becoming memorable within her life, at a time where she's very confused. So her family really weren't understanding how she's experiencing the world. And the provider and I were able to say, medication isn't going to do anything. And that united front really helped that family understand what's going on. And saying that, it's heartbreaking, right? On one side, it's heartbreaking because the family you see that they're finally getting it, what mom's going through. And on the other hand, you realize that mom's care is going to get better. It's going to improve. And sometimes that has to happen. I think of it like surgery, right? Sometimes you have to cut open that wound in order for it to heal properly.